Good afternoon. I am Tom Manning. I will serve as your host today. Welcome to our panel. It's my pleasure to invite our panelists to introduce themselves. We are here with David Feinberg, Geeta Nayyar, Lonny Reisman. May I ask each of you to briefly introduce yourself and tell us what you're most excited about that you're working on at this point in time. Geeta, let's start with you.
Sure, ladies first. Thank you for that, Tom. Thank you for having me. So I am the Chief Medical Officer of Salesforce and a rheumatologist by training. As a clinician, first and foremost, I'm most excited that healthcare remains a priority for every business out there, not just for hospitals, not just for payers, not just for pharma companies. So very excited by the customer conversations I'm having, partner conversations that I'm having across retail, manufacturing, travel, hospitality, and of course the healthcare space, but just very encouraged that everyone out there has become a healthcare business and is really in it to win it, both for their employees and for their business.
Thank you, Geeta. And David.
Well, thanks, and it's great to be here with all of you. I'm David Feinberg, also a clinician. I'm a child and adolescent psychiatrist, and for the last few weeks I've had a new job. I'm the chairman of Oracle Health, as part of the acquisition of Oracle buying Cerner. And what I'm most excited about is I think for 40 years, we've been trying to digitize the record, which is great. Like no one treated anyone during COVID and said, I can't find the chart because Dr. Smith took it home over the weekend. Like we got that part. We definitely got to fix usability. But what's super exciting is being able to connect that electronic health record to supply chain, to ERP, to human capital management, to make it cloud-based, so that digitized record gets the magic can happen where we can actually do the discovery. And when we treat a patient, we can use all of that information for a community or a population to make better decisions. So we've done so much work in digitizing, and now it's our time to really allow this to take off and make care better for everyone, everywhere.
Thank you, David. Lonny.
And thank you, Tom. Really a privilege to be here. I too am a physician. I'm trained in medicine and cardiology. I've been an entrepreneur for the last 20 years. I started two health information technology companies, which are still up and running, one at Aetna and one at Accolade. And what I've been doing lately is spending about half my time working with the Northwell Health System, which has been wonderful, just an extraordinary place with regard to its culture of clinical excellence, focus on health equity, kindness, compassion, and very importantly, innovation. So I think that health systems will play a central role as we tackle some of the problems that inevitably will come up during this this discussion, and I'm excited to be part of some of those changes.
Thank you, Lonny. Well, welcome to all three of you. We're very excited about having you with us today. And I'll just complete the introductions by saying that I currently chair Ascertain, which is a joint venture between Northwell Health and Aegis Ventures, a company that is focused specifically on AI-related innovation. And it is the area of healthcare that I am most excited about because I see incredible potential to enable us to change the system positively, really attack health inequity in new ways because of this powerful tool called AI. Now, let's get into our topics today. We really have two focal points for the conversation. They can be summarized in the what and the how. The what being, what are the newest technology trends that are disrupting healthcare at this point in time, and specifically, how will they be implemented? How can they be implemented given the many stakeholders in healthcare and the many challenges in bringing about reform, which we know do exist? Let's start with topic number one, and let me ask Lonny to jump in on the what. What technology trends are the most disruptive at this point, in your view?
Thank you. I think the trend that's most potent and most exciting to me is the notion that data will be the currency of healthcare going forward. And as we think about health inequities, we think about implementation science, the deployment of evidence-based standards to individual patients, as we talk about precision medicine and consistency. There's obviously we've discovered, we've known for a long time, there's huge variation with regard to the types of care that people receive. So I think as we turn to data and the power of those data to in fact address some of those inconsistencies and variances, there's a lot to be very excited about.
And David, from your perspective, you're involved with technology to a great degree. You see it from various angles. What is your thinking at this point?
I want to agree and add to what Lonny said. So I think it's the flow of data is starting, which is great. There's multiple sources of data, and we need to make them radically interoperable. We have to be more open and more connected. And the data is not just the EHR data, right? It's social determinants. There's all sources of data. But the real goal from all this information is being able to make actionable decisions. So I think for the first time, because we have this digitized world, digitized records, digitized other components of information, that all comes together so that we can do something. So I like to say to our team, so Cerner, Oracle Cerner, is the largest EHR company in the world from a market share standpoint. And what I say to the team is that what that means is we have more of grandma's blood sugar than anyone else. Now, how do we take that blood sugar and protect it, get it to the right person, understand whether grandma has issues around getting nutritious food, and help the rest of the family if we already see type 2 diabetes happening? So the blood sugar is the data. Protecting it and moving it around is really important. But fundamentally, it's about closing care gaps and improving health and allowing caregivers, whether that's me caring for my family at home, professional caregivers, to be able to make decisions and action on that so that we see improved health for everyone. So I just would add to Lonny's that, yeah, it's the data, but it's really then what do you do with the data and how do you do it the right way? And I know, Tom, you're going to bring up a question about AI, and I think that gets us into that same kind of discussion also.
Thanks, David. And Geeta, your perspective?
Sure. So I think after both my colleagues here, I have to say yes, agree with that, of course. But I love the grandma's blood glucose analogy, because I think for the first time, what we're also seeing is, so much was about point solutions. So much of what happened in health tech and the beginning of health tech, Dr. Feinberg knows this better than anyone, was regulation happened, point solution inserted to meet regulation. There wasn't this global thinking. There wasn't this long-term strategy. There wasn't an understanding or even the desire to really follow the data and then make those interventions, but also to have a good consumer experience. And so that grandma's glucose not only was measured, but it was intervened on, it was communicated. Everything has to be done very elegantly, and having that long-term infrastructure view versus these mini point solutions, I think is really what has changed the global thinking, largely accelerated because of COVID.
And I'm curious, what is your sense of the acceptance of additional data in clinical care at this point in time? It seems like everyone's looking to make care more effective, and yet the quantity of data is multiplying exponentially. It's actually becoming somewhat difficult to handle in extreme levels. Additionally, the quality of data varies a great deal. So this answer, while it appears to be positive and productive, also has challenges associated with it. What is your impression of the clinical response at this stage?
Hey, can I take that one?
You can. Jump in, David.
So we just, with Ascension, they were our pilot partner. We started this thing, we call it seamless exchange. And it's basically, you're in our EHR and the patient has been seen at multiple places, so they have multiple EHRs. And you go to a health information exchange, and we say to that hospitalist now, well, all the information's out there from the neighboring hospital. Well, all that information is like 500 progress notes, right? And so the data's flowing, but it's overwhelming. And I think that's what you're saying. So we created this thing called Seamless Exchange, and we really built it so that if you trusted the source, you'd press a button and it would write it in our EHR. That's what we thought. Mm-hmm. Great. The discovery, which was somewhat unintentional, is we built a deduplication engine in front. So when you looked at that information from the outside sources, we ran it, normalized it, deduplicated it, and then you decided whether you trusted it and clicked it and win your record. Here's the mind-blowing part. Progress notes, diagnostics, laboratory, 99 point something, it was different for each one of those categories, was duplicate information. So we literally are giving folks way, way too much information. It's almost like in the olden days when I would see patients and they would bring in 14 charts from Iron Mountain vanilla folders, and like, I didn't go through the whole thing. I looked for a few things. So we can use the technology to say, yes, there's a lot of information out there. How can we deduplicate it to make it easier and time-saving so that it decreases the noise? And the other EHR companies are doing this too, because what we've really done is opened up the floodgates, and it's totally overwhelming.
You know, I would add that I get back to the notion of next best action. So the data are certainly necessary, but not sufficient. And nobody has the capacity or the inclination to consume all of those data, and physicians are burning out because of that deluge. The other notion that I think the proper interpretation of data will lead to is the notion of precision or personalized medicine. And I won't go off on a long tangent about that. But what's exciting to me is that as we learn more about the human genome, microbiome, evidentiary standards, patient preferences, social determinants, all of those issues, we can get from a point we're at now, not doing it very well, but sort of aggregate measures that are generalizable, but not specific to the individual patient, to a place where not only are we being precise relative to the individual patient's needs, but we're attuned to the sort of the physiologic dynamic that's driving changes, and kind of measuring that against changes in what's available in terms of medical intervention. So there's an exciting dynamic that's emerging, and it's just a great privilege to be part of that.
And
Thanks,
Tom,
Lonnie. Please go ahead, Geeta. Yes.
I'll just pepper in. The original question was around the clinical reception. Mm-hmm. I think we all appreciate, especially as physicians on the call, where we are with the workforce today, whether it's doctors, nurses, the burnout, workforce shortage issue is very real. And so I think the biggest lesson learned from the history of health tech is doctors have to be part of the solution, right? We've got to bring our clinicians along with the innovation, along with the things Dr. Feinberg and Lonnie mentioned, as long as they are meaningful in the workflow and meaningful from a clinical practice standpoint, doctors won't resist it. Unfortunately, we made this a lot more complicated when health tech was sort of first started with the EHR revolution, and so much of it was regulatory as opposed to following the clinical workflow. When you walk around every clinic in America and the first thing doctors share with each other is the workaround, you have a problem. If you have to work around the technology in your everyday job, that certainly leads to dissatisfaction and burnout as a contributor to burnout, certainly not the only contributor. And I like to, again, it goes back to the KISS methodology. So every paper I've ever written about EHR implementations, it still goes back to keep it simple, Sally, right? It's the clinicians like for it to work. At the end of the day, got to work with the workflow. The innovations that Dr. Feinberg mentioned are great examples of that, because we are here to practice medicine. That is ultimately what our workforce has been empowered to do. They want to do, and we've got to support them. And the technology has to make them faster, better, and smarter, and not slow them down.
Well put. In a great segue to the how portion of our topic set, because it's clear that we respect innovation, we see the potential for it, but how to bring it about productively, how to overcome the type of resistance that can be normal in an organization or in a practice are relevant questions. It seems as though more and more people are attempting to collaborate in the way of innovation so that clinicians are being brought into the innovation process earlier. I know we're doing that with Ascertain as we meet with physicians to talk about the application of AI in different disease categories. It's an incredibly productive conversation to hear about the problems that need to be solved. And frankly, you mentioned workarounds. Understand the workarounds that are now part of practice that don't necessarily have to be if innovation can help redress those issues. But what are some of the techniques that you're witnessing that are helpful to ensuring that these innovations make it to the marketplace and really get turned from theory into reality?
I'll start and just mention, two areas that I think are important and effective. One is the notion of workflow, workarounds. So to the extent that insights that we've been talking about are actually built into the workflow, so as the physician or the care team are working with the patient, they can conveniently not only and easily see what the recommendation is, but actually deploy it. So sort of the transaction associated with the insight is terribly important. I think greater involvement, engagement of the patient, the consumer, making them part of this. We haven't talked much about the actual sort of target and hopefully beneficiary of all this activity, but we have to involve the patient. And the third piece I'll just mention is incentives. So as we talk about value-based contracting, value-based relationships, rewards should accrue if in fact some of the methodologies that we're discussing are taken advantage of and lead to better outcomes for patients.
Yeah, I would say that healthcare clinicians, nurse practitioners, PAs, pharmacists, OT, docs, nurses are heroes, right? And we saw that during COVID. These folks put themselves and their families at amazing risk to care for our communities around the world. And heroes need superpowers and tools. And we've given them tools that actually inhibit and don't allow them to do their thing. And if these tools would allow them to do that caring, because as I've toured around and visited with our customers around the world, there's one thing that's consistent now. Every caregiver is either sitting or standing in front of a terminal, and they're not with patients. And so we've given a tool that's actually pulled them away from that superpower and the heroism that we need. We got to build tools that do the opposite, that actually free them so they can spend more time in the exam room, in the clinic, in the neighborhood, connecting with people, engaging in the unengageable, in more healthy behaviors. And that's the frame shift that I think is crucial. In addition, what Lonny mentioned is how do we get that same sort of information to individuals so that I don't have to look through my labs. I should just be able to say into my phone, what's my bad cholesterol? And it should come up, right? I mean, that's how we think as people, and yet we're giving them, LDL over HDL, which is not really helpful to people when they're trying to figure out what to do.
Yeah, I agree completely. And I would just add on that, the concept of fear, right, really holds back innovation. And it's so important to be able to scale innovation. And clinicians are incredibly creative, right? When your job depends on it and your life and your patient's life depends on it. For some reason, we have not been as inclusive with clinical leadership in innovation and the ability to scale that in an environment that's a safe place to fail. And look, even as we talk about privacy and security and compliance, there has to be, a positive outlook on the innovation. Those things can't hold you back. You've got to push the envelope and say, to get to the other side, we are going to risk a few things, but this is going to be the space that we created, and we're going to include our clinicians. And I love the superhero analogy. I don't know if anyone remembers Inspector Gadget from growing up, but that was my generation. And I loved, right, when Inspector Gadget needed something, he would just say, go, go, gadget leg, or go, go, gadget arm. And our docs are really good at that. When you need an MRI, a CT, a stethoscope, an A-line. We know exactly how to use innovations in medicine. It's not a new thing for docs. We embrace technology every day when it works the way we need it to work for our patients, right? Technology is constantly being thrown at us for clinical tools, but for some reason on the back end administrative place, we just have not hit that smooth stride. And my hope is that we get there, because I think there are incredible ideas actually coming from the front lines, particularly after the past 2 years. And it's about that safe space and scaling it. Innovations happening in pockets is not helpful to get to the solution. We got to scale it, and we got to create that place to do that.
Well, that's a great vision, Geeta. Thank you so much, and very inspiring as well. Let me end just asking each of you for your boldest prediction about what technology improvements being seen today can do for us within the next 10 years. What is the most profound change that you are expecting from healthcare technology and where we're taking it? Lonnie, let me begin with you.
Sure. Well, first I should comment that, looking back 10 years to my predictions when high tech passed, I've been entirely wrong. So I wouldn't take anything I say seriously, but I assume that that's the case anyway. So I guess the thing that I would look forward to is a culture of trust that could emerge from using data to provide transparency, to pursue consistency, to address health inequities. There's been a lot of work by Rand about truth decay, actually phrase, and I hope that the technologies that are emerging, whether it's artificial intelligence or more straightforward analytics, insights at the point of care, all the things that we're talking about, actually somehow convince people that the system is actually designed to help them. A lot of what we've seen, certainly during COVID, has suggested, and certainly the political scene has suggested that trust has eroded. So I would hope to use technology and what we're talking about to actually remedy that situation.
Thank you. And David?
I hope, I have the same track record as Lonnie on these predictions, but I hope that the technological advances fundamentally shift healthcare from being provider-centered to being patient and family-centered. That the medical record, that information belongs to me and my family and my community, and that transition then allows things to happen that we've seen in other industries that have really changed our lives and are incredibly helpful. Right? I can take a picture of my bank, my check, and deposit it or whatever, and it's open 24 hours. So we still have a system that is designed around the clinician as opposed to around the ultimate beneficiary. And I hope that the technology changes it so that, your phone says, we've been analyzing your data and we see something that's potentially concerning, click here, schedule when it's when it's useful for you to be seen. We'll drone the stuff to your house. And our prediction is this is actually going to be a minor issue. And, we look forward to connecting with you whenever it's convenient. But it just completely shifts to a consumer world instead of the world we built, which is around the providers.
Very good. Thank you, David. And Geeta, take us home.
Sure. So again, my 10-year-old doesn't think I know much, so take all of this with a grain of salt. But 10 years isn't a long time, so I'm going to be as bold as 10 years as allows. I think we have a long way to go, particularly in AI. But I think access will have improved. A big part of what happened with COVID was the retailization of healthcare. Everybody got vaccinated at a retailer, and virtual care became, no question that we could do it. And so I think in 10 years, we will continue to make strides in both those spaces, and the access issue will be improved. That sort of supply-demand issue will be in a much better place. And I think similar to my colleagues, care and life will go hand in hand as we think about wearables, all these do-it-yourself devices, the idea that you go to your doc and you can tell them the trends in your heart rate, the trends in grandma's glucose, it won't be so novel. It will be a lot more integrated into everyday life. And this idea of the consumer-centric world where I'm going to do it, right? I'm going to collect it. I go to my doctor for the interpretation or for the action, but a lot more of that consumer power and just interest. Look, a big part of COVID is that consumers said my health is important. I better get a handle on it. And I got this watch, let me figure out all the things it can do, right? So a lot has shifted, and I do think in 10 years we will be in a much better place. In 20 and 30 years, I'm very excited to see where AI and analytics go, particularly in clinical decision support, and particularly as we think about predicting from a pop health perspective when grandma's glucose really needs to get an intervention, even perhaps before she or her doctor realizes. So we got a long way to go. Other industries have done it. I remain incredibly optimistic, and that's my story, Tom. I'm going to stick to that.
Excellent. Well, thank you so much. Thanks to all three of you. Really profound visions and compelling rhetoric and really inspiring. So really appreciate your time today. And once again, David, Geeta, Lonnie, thank you very much.
Thank you.
Thank you.